Welcome to Is Your Hospital Bamboozling You? Presented by Group 54. We all must seek medical care sometime, and we invite you to join us on our journey to help patients find the most affordable care. Beginning 2021, the federal government requires hospitals to make their standard charges public. This allowed us to 1. Evaluate pricing trends, 2. Study relationships between county demographics, hospital data and pricing, and 3. To create a patient dashboard. We selected the state of Michigan for our project and focused our analyses on cash pricing. We used 3 main datasets. Our first dataset was the pricing information. The other 2 were information on the hospitals themselves, things like ownership, revenue, capacity, and a measure on the quality of care provided. And the third one was county demographics. Here are some of the relationships we observed. Beginning with demographic factors, hospitals with higher prices are encounters with more seniors, more white residents, and a lower population density. In looking at economic factors, hospitals with higher prices are encounters with higher unemployment rates and more uninsured residents and a lower income. Finally, prices are higher in hospitals with a lower capacity and less revenue. We then assigned a price index to each individual hospital by using the relationship of its prices to the mean. Anything to the left of 0 was cheaper, and anything to its right was a more expensive site of care. Plotting this visually on a map of the state resulted in distinct clusters of similarly indexed hospitals. Examining these closer allowed us to observe the correlations at play. For example, Cluster 1 in the northern Michigan area with mostly expensive hospitals is largely rural and has the largest senior percentage in the state. It also has a low population and hospital density, which might discourage competition. Cluster 3, in contrast, around central Michigan and Lansing, the state capital, appears to have a cluster of cheaper hospitals and has one of the lowest uninsured rates and a young population, likely due to public sector employees. A future analysis might consider disaggregating the pricing data by county and exploring relationships between pricing and demographic data further. One of the challenges we ran into was a scarcity of complete data across the selected procedures. We addressed this by using a predictive model, which generated prices. We arrived at our choice of model by narrowing the list to the best performing ones based on fit to the data and accuracy rate, and optimized our choice, the random forest. This allowed us to create a dashboard to enable patients to shop for care. Here's a demonstration of the dashboard.
This is a product that allows patients to shop for services while empowering them to take a proactive approach with their health. It also gives the patient an option to shop for hospitals or services within a county, across county lines, and across different health systems. Here is how a patient will navigate it. Take, for example, a patient lives in Oakland County. So they will get a list of hospital names, different procedures with their respective cash price. A patient would also use the price index to help them pick the cheapest option available. A color scheme is also provided that identifies the cheapest pricing and the most expensive pricing. One of the things the patient will notice is that even within the same county and the same health system, there might be a price difference across the individual hospitals. This product also gives the patient an option to shop across county lines. So take, for example, the same patient wants to shop in another county. They will get the same output: a hospital name, procedures, and different cash price. In any case the cash price is not available, the patient will then use the predicted cash price to estimate the pricing of that procedure. We've seen that there is a considerable variability in pricing for the hospital services across Michigan County, and future policy efforts can focus on making the pricing data available by centering health literacy for patients and by incentivizing affordable care by focusing on modifiable factors associated with higher prices. Thank you for coming along on this journey with us.